Hello, good afternoon to all. This is Dialysis Patients Citizens Educational Facebook Live, and today is Wednesday. It's November 20th, and this is Dr. Scanterbury coming to you to ask the doctor session. I hope all of you are doing well, and I welcome you here to DPC Educational Center, where I'm here with you. My name is Dr. Scanterbury, and thank you, Nancy, for logging on. Hopefully we'll get some other folks and we can answer some questions and have a discussion about whatever is on your mind. So reach out to me. Again, this is Dr. Scanterbury, from medical consultant to Dialysis Patients Citizens Educational Center. And for some of you, you may be getting ready to getting all prepared for Thanksgiving coming up next week. And for you, if you're on dialysis, sometimes that can be very hard in terms of knowing what to prepare and what to eat and what to avoid. And with every meal, especially with holidays, I would have to say the most challenging is trying to stay away from foods that are high in phosphorus, especially since you will more than likely, for some people, they may be skipping a day of dialysis, and so they may have more time to unfortunately gain that extra fluid and that extra extra phosphorus and other things that may be restricting your ability to dialyze well. So we can talk about what you can do, but also in terms of I can answer any questions. Again, I'm Dr. Velma Scanterbury, and I am the medical consultant here for Dialysis Patients Educational Center. So let me know your questions. Thank you, Stephanie, for joining. Nancy is always here, and let me know what you want to talk about. Here in Delaware, is where I am now, is in Delaware. Weather is pretty nice. We've had a pretty dry spell, no rain or no significant rain for over 40 days. And so we are entering, hopefully, a season of dust and dry leaves and a lot of allergy season. So that can become very annoying for those of you who suffer from allergies. But one of the things also is that was helpful, especially during COVID, is that we all wore masks. And so we also had an opportunity to have less issues with allergies because we were protected. And so as we go into the fall and the season, make sure you are getting your getting up to date with your vaccinations. Make sure you get your flu if you're over 65 to get your high dose flu, and keep up to date with all your other vaccines so you can stay safe. If you are eligible for COVID vaccine, please go ahead and get that done before you gather with other folks for the holidays, because whenever we get together, it's always, unfortunately, we exchange food and dishes, but we also exchange viruses. So continue to wash your hands, stay safe, wear a mask if you feel like you are not feeling well or you want to protect yourself. That's okay too. But the goal is for us to be able to stay safe. And I encourage all of you to get your COVID vaccine. If you are eligible for it, make sure you check with your doctor. Just don't listen to me. But for many of you, you may be due for your flu or your pneumonia vaccine and all those vaccines to stay up to date. So thank you very much for joining. Again, I'm Dr. Scanterbury. Thank you, Tanya, and all the others who have joined. Please put your questions in the chat so we can talk about what you would like for me to talk about. Remember that if you're not have not been to the website, DPC website, encourage your friends and families to go on to the Dialysis Patient Citizens Educational Center website. There is a vast amount of information that you can learn from. There are extremely helpful nutrition tips, recipes, things to help you improve your overall health, and also to answer your questions about treatment options besides staying healthy, improving your quality of life. How can you do more to get there? And also so many resources, especially if you have friends who speak Spanish. There's Spanish resources on there. And there are fact sheets. There's also information state by state, because if you live in one state, some of these rules and regulations may not necessarily apply to you, but you may want to check what's going on in your area. And one of the things that you can also look up, especially if you're on dialysis, is you can get information about how many transplant centers there are, and you can also find out the other resources for you to be able to improve your life. And so that's a lot of information that's on there. As far as nutrition, we talked about that, but also when you think about quality of life, and for many of you, some of you may work, some of you may not work. Sometimes being on dialysis can impact our physical health, and you may have many challenges. And so there may be resources there that can help you, even dealing with depression. Mental health is a really big issue, and thank goodness that we are now at a place where it's okay to talk about it. And you want to acknowledge others who are facing difficulties and having issues with depression. And the whole stigma around depression is waning, and that is so very important, because we're not here to judge others, and we don't understand, we can't walk in the path that others are walking. So we have to understand and be sympathetic to their situation. And I'm sure just being diagnosed with kidney disease and being on dialysis and trying to maintain a positive outlook can often be difficult, and it's okay to seek help. It's okay to need medications, as mental health is a disease just like a heart disease, and we can't always take care of it on our own. So it's very important to be supportive of not just you, but also your family members and others. Caretakers, they may also be having a hard time in terms of knowing that they may not be able to do as much as they would like to. There's feeling like they are unable to change the situation. So certainly if you have not gone to the website and received some information, I encourage you to do that, and to encourage your friends and families, and even those who may not necessarily be on dialysis. They may not have a kidney transplant, but they may know others who are in that situation. And so by having that knowledge, you can be a resource to other people, and you may be able to provide them with information that can be helpful to them also. I think we all know someone who has kidney disease or maybe on dialysis, and so having these resources is important because it can help others get there. So I appreciate that, and appreciate all of you who have joined. I am Dr. Scanterbury. I am the medical consultant for Dialysis Patient Citizens Educational Center, and I am here today to answer your questions. And so I have been talking, but I certainly hope some of you have some questions. One of the things is certainly let's talk about if you are thinking about getting on the waiting list, or you are stage 4 and seeing your doctor, and you know that there's a path forward that either involves some kind of replacement therapy. And it's important to understand that there are opportunities, especially if you have a living donor or your disease is slowly progressing, that you can be listed for a transplant, or you can undergo a transplant without needing dialysis. For many patients, the EGFR may be as low as less than 20, and your center can use that number to list you for transplant, even though you're not on dialysis. And that's so very important, because You may be at that stage 5, but you're not ready for renal replacement therapy. But you can accumulate that time long before you get in dialysis. And I've had patients on the waiting list for 2-3 years with stable renal function at stage 5, but not needing to be transplanted. And that time can accumulate until you start dialysis or until you get a kidney transplant. For some people, they may even be offered, if they're doing well, they may have that opportunity to receive what we call is a zero mismatch kidney. Generally, someone is doing well and not on dialysis. You may not be offered the same kind of kidneys as someone who are in a dire situation, but you may have the opportunity to receive a near perfect matched kidney, in that we say there's no mismatches. And most transplant centers will reserve those for patients who if you may be on the list, but we will not use every single offer that's coming down there because you're doing so well on your own. But it is important to know that you can be on the list for many years, or at least some time, varying from patient to patient, without needing to start dialysis. And we know that once you start dialysis, the countdown starts there, regardless of whether you're on dialysis or not dialysis. So if you're been on dialysis 5 years and now you're coming to be evaluated for transplant and you get listed for transplant, then the entire 5 years go to your waiting time. So once you start, there's no rush to get on the list, but it is important to understand that time on dialysis certainly plays a role in your outcome and the longevity, how you do long term, so that patients who are on dialysis less number of years, 0, 1, or 2, fare and do better than patients who are on dialysis for 5 or 10 years. And why is that? Mainly because long-term dialysis, especially hemodialysis, will alter your underlying heart disease and increases your risk for worsening heart disease. So with minimum time on dialysis, there's less trauma to your heart. If you think about hemodialysis and how you gain fluid on dialysis, and that fluid then is taken off whenever you go through dialysis. So you wax and wane with fluid volume that challenges your heart, and eventually over time will decrease your pumpability of your heart, or what we call your ejection fraction. So that's very important, and some recent studies have come out looking that certainly having kidney disease or having diabetes and kidney disease, it worsens your risk or increases your risk of heart disease significantly in terms of men versus women, in terms of at least 20 years earlier risk of heart disease coming on at a significant earlier date. So while you are, and that's why it's important when we evaluate patients to be able to have them go through cardiac testing. So am I missing some questions in the chat, or I don't want to be the only one talking. Again, I'm Dr. Scanterbury, the medical consultant for Dialysis Patient Citizens Educational Center, and I want to be able to answer your questions. So come on, let me know what you would like for me to talk about as we continue this conversation. And thank you all for joining. Mona, Nina, and Carolyn, I thank you for coming on. George, where are you guys hailing from? What state are you from? And are you on dialysis, or are you a kidney transplant patient? If you're on dialysis, are you doing well? Are there any issues you would like to discuss? And as well as if you have had a transplant, how many years, and are things going well? And we know that with transplant, patients have to, for instance, you need, just as when you are diagnosed with kidney disease, some patients will get biopsies. It's important to know your underlying kidney disease, especially after you get a transplant. You can get what's called recurrent disease. And for some patients, we want to know if that's recurrent disease is due to something that was not diagnosed before they came to transplant. So that becomes important. So certainly many of you will get a biopsy before, and we know that many of you will also get a biopsy if you've had a kidney transplant, and certainly it's important to evaluate your transplant for rejection. Why is O positive so hard to transplant? Because the majority of the population is O positive. So unfortunately, when you think about those listed for a transplant, the O list is going to be greater than the A list, which is second than the B, and the least number of people will be AB. Unfortunately, O can give to A, B, or O, but O can only receive from O. So that makes it a little bit difficult, because you will have many more patients on the waiting list with blood type O. And so that becomes an issue with the more people on the waiting list. So if you were AB, that would be the total opposite. There will be fewer people to compete with. So you have to wait for, as a blood type O, you have to wait for an O donor. So that's why it's important to, one, talk about your circle, talk to your family and friends, because we've had so many patients who've had direct kidney donation because somebody knew that they were on dialysis through their family or their friends. And that becomes critical, because now you have someone who has a loved one, unfortunately, who has passed, and you realize, oh, Mr. Jones is on dialysis. He works with my mom or my aunt, and he's waiting for a kidney. Perhaps one of my loved one's kidneys can go to him, because they remember that conversation somewhere along the line. And that comes through really advocating, telling your story, because even your story about how you ended up on dialysis, whatever your kidney disease is, can often touch other people. And they will remember, oh, I need to get my kidneys checked. So if you save one life by one person going or remembering that you were diagnosed acutely and they have diabetes and they decide to go get the kidneys checked, that's a plus for you. So sharing your story is a way of educating, and it's a way of letting others know that they can also do something before it gets too serious. So unfortunately, as more and more people survive and we live longer, we have more and more people being added to the waiting list. So certainly we want people to think about possibilities of living donation. Is there anyone in your circle who can donate? You can even think about friends of friends, those who you went to school with. You don't have to be of the same blood type. We can do pair exchange from that perspective. Even sometimes patients will have antibodies that prevent them from donating to one person, but you can put them into a pair donor match and allow that transplant to occur. So in terms of being creative and thinking about how can I get this transplant, continue to engage with your community, continue to be an ambassador, to talk about it and educate others. And you don't know whose heart may be persuaded that this is something that they may want to be able to do to help you. So continue to be hopeful. Thank you so much. Again, I am Dr. Scanterbury. I am the medical consultant for Dialysis Patient Citizens Educational Center. And we, as Yolanda says, we welcome all of you. And if you're not already a member of DPC, please go on and join our community, because there's so much to learn. And even if you don't have much to say, you can often participate. You can just be on the sideline. Stephanie Ditson, great too. You're hailing from the state of New Jersey. Thank you so much for watching. And those of you who are here, as Nick says, 22 years. Thanks for sharing. Hoping for another 10. I'm 72 and 6 months. Thank you so much for sharing. I appreciate that, and I hope you continue to do well and have another 10 years. So you and that kidney are in harmony, and that's a blessed thing. Other people may not necessarily have a smooth course, and there are others who unfortunately will not be able to hold on to the kidney transplant either because of rejection, also infection. Many patients get infections such as CMV infection and BK infection. And when you try to treat those by lowering the immune system, oftentimes it can spark rejection, and then you have another issue to deal with. So that surveillance after transplant becomes critical. It's important for you to continue seeing your doctor, getting your blood work as they have asked you to, because even just checking your urine becomes important, because when you have a kidney transplant, rejection isn't obvious, and you may feel fine, you may still be making urine, but it's that blood work that would warn the doctor something is awry, or that urine test, you may have more protein in your urine than you did before. So that's the key. Oftentimes as we get further out, we will often go longer periods without blood work, but I tend to be on the safe side for many of my patients and say 3 months is the biggest window that I want for you to go without checking your kidney function. Thank you for those hailing from Minnesota. Thank you so much, Ramona Banks. I appreciate that so much. So thank you for joining. Again, I'm Dr. Scanterbury. I've been doing all the talking. I don't see, it was one question, but thank you guys who are doing well. California, and all those who are watching, we appreciate you being here. If there is anything that I can answer for you, please let me know. Drop it in the chat. Again, I am a retired transplant surgeon. Continue to advocate for my patients. I now have a clinic where I see patients for general medicine and have a whole bunch of patients who are on dialysis, awaiting transplant, trying to get on the transplant list, going through that workup. Sometimes it can be very tedious and nerve-wracking, and involves a lot of time going to many doctors to get all the tests that are needed. But remember, that is in order to make sure you are as healthy as you possibly can before you hit transplant. And that is understanding that we want you to be free of cancer, because while you're on immunosuppression, your body is not going to be able to fight off any cancer or abnormal cells. We want to make sure your heart's okay, because we know that end-stage kidney disease, dialysis, and high blood pressure can lead to heart disease. And the longer you are with those diagnoses, the more issues can arise with your heart. So we don't want those heart issues to be appearing after you've had the transplant. We want to be able to deal with them up front, get your stents placed, put you on the right medication, and most of all, make sure we can get you through that operation without any significant issues while you're on the table. The transplant itself is probably the least issue, is dealing with how your body deals with that new kidney afterwards and trying to prevent rejection. So there's a lot of medicines that are dumped on you within that first 24, 48 hours in order to shut down your immune system and override any ability of your white cells to say, hey, I see something different. So you're knocking them all out, and sometimes when you do that, you're also knocking you out in terms of wiping out your ability to feel well. And so many patients in that immediate period, it's important to get them through that. If you're young and healthy, that works out pretty good. If you're on the older side, it becomes a challenge. So for some patients, we may have to put them through physical therapy to make sure they have enough stamina and endurance to get them through the transplant, because we are going to get you out of bed and we are going to get you moving, and that becomes so very important. Thank you, Anna. Anna is from Savannah, Georgia. She's on home dialysis since May of this year. And thank you for that, because we know that as a home dialysis patient, you have better control of regulating your fluid status. You have better control of keeping your heart disease to a minimum because you're dialyzing more often, and you're able to control your fluids, your excess, and not challenge your heart as much. So thank you for that. The goal really is to encourage, and if you can encourage others to do home dialysis, that would be a blessing also, because it is important. It's a lot easier on your system than in-center dialysis 3 days a week. You have the option of doing 4 days or 5 days or 6 days for a few hours a day, and that is, your body is able to tolerate that so much better than trying to take out 5 or 6 kilos over a long weekend, because you gain that much fluid, and imagine what that does to your heart. So I appreciate you sharing that with us, and thank you, Abkar and Claudia. Thank you for joining. Again, I'm Dr. Scanterbury with Dialysis Patient Citizens Educational Center. We're here to talk about questions, but I've only had one question so far. Been doing all the talking, but I want to know if there are any issues that I can tell you about. We know that we said earlier that we are now a week away from Thanksgiving, so we know that's a holiday where you guys would all be gathered together. Make sure that you stay safe. Get vaccinated, so that as you gather with your crowds, you put yourself at less risk for taking something home that you don't want to take home, and that's COVID or flu. So make sure you get your flu shot and your COVID shot, and any others that you're due to. You can have up to 3 at one time, especially if you are eligible for RSV or any of the other viruses. Certainly, we want to be careful about your volume. Keep it down to a minimum. Make sure if you're on dialysis that you're more cognizant of what you're taking in, especially if you're not on home dialysis and you have to go to in-center, then you don't want to overload your heart over the long weekend, especially if you're skipping a dialysis day on the Saturday, but hopefully not. And for those of you who are in general, certainly the most thing is making sure you keep your blood pressure under control. There's a lot of good food, there's a lot of salty food, but you want to be careful about your intake and not pay a hefty price after eating all that stuff. But moderation is key. You can have a small portion and portion control. That's generally what I say. So thank you so much. As you said, we're all in this together, and I hope that you guys can continue to encourage your friends and your family members to become part of this community, DPC. Go to the website. There's so much on there that you can learn from, and can be informative in terms of helping you get through tough periods, helping you find others that you can perhaps reach out to. That becomes important, to have a community. And remember, you're not in this alone, and that there's others who can help you get there. Whether you need motivation, whether you need recommendations for what you can do to make things easier, it's very important to be able to say, okay, DPC has lots of ambassadors, and they advocate for us, but they're also there for us, there for you also when you need it. So especially to Nick, I know you're new to this, but I want you to know that this is a community that you can depend on and become part of. So thank you so much all for joining. And I've had 30 minutes of talking, and hopefully next time we gather together, we will have more to discuss. And so I think this may be it for 2024. I'll see you guys again on Instagram coming up, maybe next month. But take care, everyone, and thanks for being here. Happy holidays. Stay safe, and be blessed. Stay blessed. Thank you so much. Bye now.